welcome back to From Belly to Baby. I'm here with Dr. Camaryn Chrisman Robbins.
Again.
Love it when you're with us.
Yay!
I'm so excited. I was just telling her, I was like, I really, our conversations just sort of go crazy every time we're here.
Yes.
So the agenda is pretty limited on this one because I know we're not going to cover everything on the
agendas don't work with the talking and the questions and the side notes about Slim Jims.
Yes, exactly. There are no Slim Jims in the purse. The M&Ms that were there are now gone.
You had M&Ms?
I did. I'm sorry. I ate them before I came over. And so it's pretty much just a wallet, which is really boring. But my name is Abby. I would say your host. I was going to say cute, and it's so funny because I don't notice. I'm 28 weeks along, and if you're watching and expecting, please note in the comments how far along you are as well. We'll ask you to do that again a little bit later, but 28 weeks, so officially into the third trimester, and I swear there was a point maybe 2-3 weeks ago that I woke up and I thought, well, I'll be darned. There's actually a baby in there. Like, there's something growing in there.
2 weeks ago?
Yeah. Oh, no, I know. It's crazy. It was much later than most people.
Interesting.
Yeah.
Like, you didn't feel movement, or you just didn't...
So, I have an anterior placenta, which means the placenta is growing out here, correct?
Yeah.
So, I don't feel a ton, even though apparently, judging by ultrasound and even when heartbeat and everything, the kid moves around a bunch. I can feel it, but not...
Wow.
Like, not all the time.
Okay.
So, but in addition to that, and it was just the whole idea of, I don't know if I've just been busy and didn't think about it, but I mean, only this last week did I start realizing, oh, the kid's going to need a place to sleep. Which means, even if it isn't a drawer, it needs to be an empty drawer, as one of the nurses pointed out. So, yeah.
I think you're ahead of the game on that one.
Okay.
I'm a little behind the game in terms of typically there's a human in my uterus punching me.
I felt I've been fortunate that I felt okay, but I've felt very tired, and other than that, pretty much fine.
Are you napping?
No, I'm not a napper. Though I will say, and this
pregnancy
goes back
naps
to,
are the best.
I wish I were. I'm told I will get over my issue with napping. But one of the things in the second trimester, and it's probably something a few people have delayed. I think you can do it up until 28 or 29 weeks. Correct me if I'm wrong. The glucose screen.
Yeah.
28. So
in a perfect world,
I think mine was done at 27 or something like that. I can't remember. First of all, the orange drink that everyone tells you is so disgusting. I was really prepared for it to be awful. I found it oddly delicious. So don't believe everything everyone tells you. You might enjoy it.
All right.
But
are you a sweet person? You like sweets.
I can live off of sugar, no problem. Yeah. But then, in addition to testing glucose, it also tests at the point at which they test your blood for iron levels as well.
Yep.
And mine came back anemic, and I've
talked. How anemic?
I don't think
like
terribly.
A touch anemic or like whoa anemic.
I don't think whoa.
Okay.
I'd have to look up a number for you.
You don't have to tell me your private information, although that's kind of what we're doing.
We're over that. I think high 20s.
Okay. Yeah.
So nothing terrible, but I will say whenever I started on the iron pills, about 10 days later, I started to feel a whole lot more. I don't know if energetic is the right word, but not like I was moving through mud the entire time. But apparently anemia in pregnancy is not uncommon.
Not uncommon. It's actually the rule, not the exception. It's just a matter of how much. Okay. So everybody gets a little bit anemic in the third trimester because your blood volume triples, but your red blood cells don't triple. They stay the same and go up a little bit. So it's dilutional. So the same amount of red blood cells is floating around in triple the volume.
Oh, interesting.
So you get a little anemic. Some people get really anemic and they don't feel good for sure. They feel like mud, going through mud, just like, ugh. And then people aren't very sympathetic to you because they're like, well, you're pregnant. But really, like, sometimes there's reasons.
And even complaining about being tired. And I blame the fact I was raised by a doctor, and I don't know if you're the same way with your kids. Like, my brother had a broken arm for weeks or a week before it ever got checked out because you're just assuming everybody's going to be fine. And so my instinct is not to complain about health issues.
I'm the opposite.
Really?
I'm like the... I'm a mess. I Google things. I do. I'm sorry. When it's my kids.
Got it. And you confessed it too.
I am. I'm trying to be open. You just shared your anemia. I'll share it.
Share your Google confessions?
With my kids. With my husband, I'm like, Sorry, George, but like, get over it, move on. But my daughters, yes.
So Jocelyn just chimed in. She is 33 weeks and 4 days in the home stretch, but she is, from anemia perspective. She was 9.8 after 2 iron infusions.
Whoa.
And she needs 2 more rounds.
Sorry, Jocelyn.
That's legit. That makes my high
legit.
20s seem... That poor Jocelyn was awfully tired.
Oh,
I'm so sorry to hear that.
It will get better after delivery. All of this resolves itself if the reason that you're anemic is because you're pregnant and not something else.
Oh my gosh, that's wild. So I know you're welcome to chime in with your personal experiences. Also with any questions you have, we'll try and address them as the hour goes on. And if there's any questions that you have that we can't answer, we'll certainly look for resources offline and respond to you after the show as well. So keep them coming. We do love to hear other people's experiences. That's the point of being here. But it is amazing to me, that whole in 12 weeks, 13 for sure, there's going to be a person here. Mm-hmm. And so does a lot change in the 3rd trimester? I mean, as I told you beforehand, clearly you stopped gaining weight, because 30 pounds up, mm-hmm. I can't possibly gain another ounce through the rest of this.
So I think you just sort of gradually go from that. A lot of people describe an energy burst in the late 2nd, early 3rd trimester. People maybe associate it with nesting. You want to paint, you want to fold, you want to do laundry, you want to make the baby's room mm-hmm. ready, and that is an energy burst. And then I think for most people there comes a point where it's just like, I got to get through my day. It's, you don't feel the same. Swelling of the feet is almost mm-hmm. universal. Some people have really bad swelling, and if you're concerned at all about your swelling, please talk to your doctor, because sometimes it's associated with high blood pressure condition in pregnancy called preeclampsia. Mm-hmm. And if the swelling's in one leg more than the other, a lot of times that's just because the way your uterus is sitting in your pelvis, it's sort of compressing the veins on one side versus the other. But you can get blood clots in pregnancy. Mm-hmm. So if one leg is more swollen than the other, particularly if it's tender or in your calf or red, please see a doctor right away. But take away all the scary stuff about swelling. It's just uncomfortable to walk around with balloon feet mm-hmm. and, embrace the croc. Who cares? Like, give up
what?
The croc.
The croc shoes. I was like, what?
Who cares? Like, the strappy.
The croc pot? I don't understand. But the shoes.
We'll get to crock pots later.
Yes. Oh, that comes after.
Because when you're tired and you don't want to cook.
Yeah, it's a magical tool.
Yeah. But you just have to just get through it. Mm-hmm. Compression stockings are the jam.
Oh, really now?
Oh my God. You don't have them yet?
No.
But you're not swollen yet. You won't. Maybe you won't be.
I flew last week, and it was amazing when we landed. And you always, your rings are always a little tighter, things like that after you fly.
Yeah.
I got off that plane, took off my shoes, and there was a clear imprint of where my shoe was and everything else. I said, "Oh my God, it's going to go back to normal," and it did. But it was, I think, a sign of things to come.
Yeah, I would say think of the compression stocking, whatever. So many runners wear them now that they're in a lot of nice breathable fabrics, which wasn't even the case 5-10 years ago. You had to get, they're like knee-high, they just help with circulation. So imagine the Golden Girls, like Sophia Petrillo would have worn the thick, like nude-colored knee-high socks, right? For her venous circulation, right?
Sure.
Anybody like a Golden Girls but me?
I love a good Golden Girl reference.
But now it's like there's ones that look like nylons. There's ones that, like I said, people run in that have a lot of breathability, and it just squeezes the fluid out of your feet. And some people need to wear them up to their thighs, but I think in pregnancy mostly you can get by with just knee highs. It's not about fitting into shoes that are cute. It truly makes you feel better.
Okay.
Google it.
I will say the whole fitting into shoes that are cute thing, it really did go out the window early. My feet grew a half size really fast. So it just became, get something that I can look quasi-professional in through the day and be okay with it.
And that's a real thing too. Your feet do grow with pregnancy.
Do they ever go down?
No.
Oh, bother. I have a lot of shoes that I'm going to need to start auctioning off on this show because they're
something
lovely.
I wish people would have told me. I didn't ever hear that before I had kids, and I have a thing with some shoes that I bought that are nice, and I can't wear them.
Oh, that's so disappointing. Okay, well, I will adjust to that reality.
Just have it in your mind.
Okay.
Yeah.
All right, and so now into the third trimester, I know that you become BFFs with your doctor. At least you're seeing them a whole lot more often, or at least in the practice a lot more. Every 2 weeks now?
You go to every 2 weeks.
Okay, and what is the point of that?
Things can kind of change quicker in the third trimester, specifically with blood pressure issues, fetal growth issues, and it's just more questions come up. You feel worse. Hemorrhoids, let's be honest about this.
So I have to admit to, and it was not necessary, but Googling hemorrhoids last week, because I never knew what they were exactly.
Google.
So let's clarify for folks out there. What are they? What causes them? And how do you know?
So this human, is in this human is in your uterus, and it's growing, and there's a placenta and fluid, and the muscle of the uterus is full of blood, and it just gets heavier and heavier and heavier, and it just pushes down with gravity on all the big veins in your pelvis. Some of those veins take circulation from your rectum back up to your heart, etc., right? But imagine those are basically pinched off, so the blood can't move back as freely, and it kind of pools, and the veins can sort of pop and be like little balloons of blood. And they're at either the outside opening, or they can be up in the inside. Okay. And they are uncomfortable. The blood can clot, and they can get really sort of inflamed and painful. Most of the time it's just like people describe itching or pain, blood when they have bowel movement. It's literally gonna happen, like just it is, and it's okay. It goes away. But if it's really hurting, or you're having a lot of bleeding when you go to the bathroom, go see your OB and specifically talk about it, because no one's gonna necessarily look at your butt if you don't ask for it.
That is another something to print. Maybe we'll put that on a
so many T-shirts.
Yes, I think we'll put that on a.
But there's things to help. So so it's something that can be treatable. Start with witch hazel pads. Did you love that?
Yes. No one's gonna look at your butt unless you ask for it.
Unless you ask for it. Well, it's like I've had this conversation in my own home before. I'm sorry, if you stamp something across the seat of your pants, you can't expect those around you not to read it. So that I think we should stamp on a pair of pants.
Yeah, But Tux pads are just witch hazel.
Witch hazel, all right, got it.
That can be helpful for minor cases, preparation age, etc. You can anything is safe in the drugstore. Don't worry, you're hurting your baby. If at 2 a.m. you're miserable and you want to try something from Walgreens, you're fine.
And that brings us back to the one issue I have struggled with tremendously, but I know many people have it much worse: heartburn. And I told it will not get better in the third trimester.
Oh gosh, no, you have to up your game. So you can do a daily, anything from the store is fine. Zantac, Pepcid, I don't care what it is. Do it every day, maybe even twice a day if you need it. Have Tums in your purse. Maybe sleep on a couple pillows if that helps. And you may not be able to do like tomato sauce, like high acid foods. It's just you've got two things going on. Number one, that baby that's pushing down and giving you hemorrhoids, lucky you, is also pushing up. And so your stomach is squished. So all the acid from your stomach is going into your esophagus. And as if that wasn't enough, being pregnant makes the muscle in your esophagus that holds stomach contents out relax. So it's like a free-flowing acid situation.
It's one giant party is what it is.
No, it's the third trimester is super elegant.
Fun.
Yeah.
It is amazing the number of things.
But it's beautiful and wonderful.
Oh yeah,
but
exactly.
It's also like
totally. But it is amazing in the number of things that I can't believe the number of things I've called friends and I've been like, okay, I need you to just take off your judgment hat and listen to this and tell me if I'm crazy. And it's all been stuff like, oh, everybody goes through that.
Yeah.
And it is incredible to me the number of disgusting, weird things that you don't know before you get pregnant, and that apparently most people forget upon seeing a pretty baby. Or at least they block some part of it. So that I always talk about my sister-in-law who has wretched pregnancies, and she's like, it's weird, I don't associate it with the kid or blame him at all.
Well, the human species would have ended
a long time ago
if we remembered our third trimester.
Yeah. And the other thing, and it's...
Oh my God. But look at your hair.
The hair
benefits, luxurious, thicker hair.
I have nails. My nails.
Nails. I was noticing your nails.
I can claw through drywall right now. Mm-hmm. They need to be managed.
Amazing. These are good things.
Things like, the only problem is, you cannot reach my toes to paint them, but it is incredible how
a lot of women report a bump in libido.
Interesting.
Third trimester libido bump. Normal, fine, enjoy it.
When you're talking about things that improve around, do you see, because I was always told there was an energy burst, expect an energy burst in the second trimester, and I never experienced that.
Late second, early third.
I was gonna say, I credit it to taking the iron, but maybe it is just, feeling, because it wasn't, clearly it wasn't as bad as other people have experienced, but so that there is some energy increase that happens, that can happen into the 30s, would you say, or is there a point at which things?
For sure. I think it's all over at 35.
Okay. It's all over at 35. Duly noted in life and in pregnancy. All right. No, not at all. It gets more exciting after 40. So really, if you think about it, I always put it in the context of, okay, so there are 12 weeks to go. We had to keep this a secret for 12 weeks. Well, really, it wasn't even 12 weeks because we didn't even know for 12 weeks, like for 8 before you're telling people. So it is incredible how, how when you put it in that perspective, time is going to fly.
It is.
It's going to crawl at times. But in the scheme of things, I think it boggles my brain. I think
of everything, like you're just like sitting, watching House of Cards, right? And there's like a baby kidney, like filtering fluid and exercising muscles and brain development, and you're just with your Jennies watching House of Cards. Like, how would you? It's just amazing.
Yeah, ice cream. By the way, we were discussing that beforehand. Yeah, she still hasn't experienced the Jennies ice cream. We're going to take care of that in one of these days. I was telling the story of I went to the grocery store the other day and came home and I got fruit and all of that good stuff. But my husband came in and he opened the fridge, opened the freezer, and he comes and he goes, "Okay, I see we have 4 cartons of ice cream, but there's no lunch meat." It's like, well, there was no specific.
Don't send a pregnant lady
for lunch
to the store.
But there is gourmet ice cream.
Yes.
That you are welcome to enjoy as long as you don't eat the last of it.
We'll do a thing. We'll go. I want to go. It'll feel like an event.
It will. It'll be celebratory. It'll make it an event. The other thing with when you're talking about everything being so crammed in that I've noticed, and
is my coat funny? I feel like it's
nope.
You're good. You're all buttoned up and ready to go.
Okay.
Is the kid pushing your lungs out of your mouth, or what exactly that's causing the
you have less lung volume?
Yeah, and it is because I even try and take a deep breath in the morning and I start coughing.
You breathe more per minute because you have less lung capacity and you don't breathe as much volume. So a flight of stairs, it's rough.
Oh, it's totally different.
Yeah.
Completely different.
People who do marathons and half marathons when they're 38 weeks, wasn't there someone that did Boston a few years ago or last year who was 30-something weeks and then went into labor and had a baby? That's cool.
Apparently that works.
But I felt great running. Loved it. And with both my girls, there was a definite day that was like, this will not happen ever again as long as I'm pregnant. But there's a point where your body will just tell you, like, this doesn't feel good anymore. And both of them were in my 3rd trimester, so I wonder if you have noticed any changes in like what you want to actively be doing.
I've been okay. Like I said, I am a slave to the step count each day, and I have
your little noticed polka dot.
Thank you. Gotta keep it somewhat trendy. But I've noticed that it gets harder and harder to hit that 10,000 mark each day. And like last night, I went for a walk and was just trying to get through that last 1,000, and that doesn't take very long. It's just a couple of blocks. And by the time I got home, I was just done.
Yeah.
I'm so tired. And I don't know how a walk around 2 blocks could possibly knock me down so fast. But
all these things,
and the precious little cargo and what have you. So you go to the doctor every 2 weeks. And any advice for those trips? Because the content of the exam doesn't change much. You said it's still weight, urine check, blood pressure check.
Listen to baby,
measure.
That's really it. And as you've noticed maybe from our conversations in this Facebook Live session versus the other two, this is really a lot. Your doctor may seem like they're not doing anything as much, and I know it might feel like that, because if you're healthy and your baby's measuring fine and your blood pressure's good, the visits are short, but it's also an opportunity to address stuff that you're worried about, like, oh my gosh, I think I have either rectal cancer or hemorrhoids, right?
I shouldn't laugh at that, but yes, I know.
You don't know.
Well,
there's like a thing, and you don't know.
Too. Yeah.
So recognize that a lot can happen quickly. We want to see you more because we want to be able to make sure everything's going okay. However, take advantage of the time for us as doctors to have fewer things on our checklist as compared to when we see you once a month. We kind of have a lot we need to get through. When we see you more frequently, we have less we're checking off as long as you're doing well. So write stuff down. Like, remember to ask questions.
Yeah, write it down is pretty critical. I don't remember anything I say 15 minutes later. So the writing it down is pretty key.
And it's a lot of coaching and normalizing your experience, addressing your expectations. Maybe you're feeling, despite the fact that so many people feel that sort of rush of energy and the nesting instinct, you may be starting to struggle with some mood stuff, and being hard on yourself. Like, everyone else seemed fine when they were in their third trimester and I'm feeling sad. Like, talk it out. Like, these visits don't have to be all about medical stuff. It can be a lot about just supporting you and addressing your concerns, and take advantage of the time.
And I know that we've talked about this before, and it's something I've noticed in many practices along the way, that it's not a burden to ask questions. It's a good thing.
We literally expect you to.
Yeah. And that's why you're there.
Yeah.
So that's good to know. And so then at what point do you start going every week?
36.
And at what point I feel like I'm quizzing you. What point does the baby, when does its head go down?
That's a good question. Typically around 35, 36 weeks, right? So wherever your kid is at that time is likely where they'll stay. These are not hard and fast rules. Somebody came in last week for a C-section for breech, and her baby had flipped to head down, like in the last week, which is very unusual. Things happen, but my practice, for example, will automatically do just a bedside ultrasound, not a formal ultrasound in the ultrasound clinic, but just us throwing the ultrasound on to see where your baby is at 35, 36 weeks. And then also collect a Group B strep swab.
Oh, yeah.
We should totally talk about Group B strep.
I was reading something about that the other day, and it was a whole new world. So I remember hearing about it. I remember the doctor going over that at one point. But what is it, and how is the test performed?
Okay. So it is a bacteria that all humans have. It actually keeps our gut healthy. It keeps our GI tract healthy. So the fact that you do or don't have Group B strep is only a sign of whether, when someone rubs like a Q-tip swab on your butt, we're back to the butt, but it's the truth.
Who knew it would be this important?
So to really get a Group B strep swab, you have to take a swab, go over the vulva, a little bit into the vagina, and a little bit into the rectum with the swab. It's a tiny Q-tip, but that's the way to do it right. If someone just swabs the outside of you, that's not a good test, because what we really don't want to miss is if in a moment in time you happen to be colonized or have that bacteria living on the outside skin, baby can get it through the birth canal during delivery. And it's a bacteria that, while it's healthy for us and keeps our gut healthy, newborns can get very sick from it. And they can get pneumonia and meningitis, and they can get really sick. So we've started, I don't even know, don't tell people that I can't come up with right now when we started universal screening for Group B strep, but we screen everybody. And if you are positive in your last month of pregnancy, we automatically give you antibiotics through the IV when you're in labor. And that's to protect your baby. It's nothing to do with mom's well-being.
Jocelyn asks if you get this test.
I think Jocelyn's the only person watching.
Hi, Jocelyn! Beautiful day. And we always say,
so pretty out.
It is a direct correlation between the weather and how many people are watching. But thank you, Jess.
Yes.
She wants to know if you're having a planned C-section if you get this test too.
That is.
And she says hi.
Hi, Jocelyn. You stole my thunder, lady. I was going to say that next, and I'll tell you why. You can have a C-section scheduled, but your water breaks and you go into labor at home. And your baby is then exposed to... So some people who have a C-section, if they go into labor on their own, would choose to try for a vaginal delivery, depending on the circumstances, etc. So it's valuable to us to know if we need to give you antibiotics or not. Because if we swab you when you first come in labor, those results won't be back by the time you have your baby. So it's just really good to know. Yes.
Good to know. Are there any other tests that you perform or that are expected through the end of the third trimester?
We usually check another complete blood count, and that looks at your iron levels and your platelets. And HIV screen should be done in the third trimester at some point, either at the 28 weeks or in the last month of pregnancy. And that's standard CDC guidelines.
Gotcha.
For everybody.
All right. And so in typical, general...
Syphilis. We're supposed to start screening for syphilis.
Oh.
Denise Willers is my partner. She's getting us to be, this is new. It's new to universally screen everyone in the third trimester for that as well, because syphilis is on the rise.
I know that in
Doesn't
this
it seem
region
so old-fashioned?
yes.
But it's like real, and it affects babies real. If mom has it when she's pregnant, the babies are have a lot of problems. So
interesting. Okay.
It's a big deal.
All of these tests are obviously it's important, I think, to know too that I know it was so befuddling to me whenever they said you need the HIV and there's an HIV screen included. It helps to know that it is universal and that it is not
everybody
based on any sort of perceived life choice that the physician has. It's just to make sure.
It's a good point to say that. Yep, and that just takes the judgment out of me looking at someone and thinking, should I screen them for HIV? That's a terrible position to put anyone in, and it is actually not valid in any way, because people, there's all sorts of cases in life where somebody may be involved in high-risk behaviors that you would never know, and they aren't comfortable telling you, even in a doctor-patient sort of scenario. So the CDC just puts these blanket recommendations out to keep all of us safe. And it's a blood test, so it's nothing crazy.
And at this point, you kind of get used to being poked and prodded. I said at one point I was wearing stripes. I think I actually texted Jenny, who's behind the camera. And I went into the doctor's office, and you have to do the standard pee in a cup, blah, blah, blah. And I was like, I am wearing black and white stripes, and I'm peeing in a cup every 2 weeks. I feel like a prisoner. I'm pretty sure that's what they do. And it is not, not in any sort of bad way, but I'm like, I think this is pretty much the same drill. But yes, we have another question. Yes.
Michelle wants to know how dangerous it is to sleep on her belly, because sometimes she wakes up and doesn't even know that she was doing it.
Michelle, I am so glad you brought this up, because I would have forgotten to. We'll address her point first and then go from there.
It is not dangerous.
Okay.
You're fine.
And on the back, same deal?
Yes.
It's not comfortable.
I really truly believe if you're asleep on your back and your brain isn't waking you up a little bit to shift, you're not far enough along that your uterus is heavy enough that you could be compressing blood flow.
Okay.
Same thing about sleeping on the belly.
Yeah.
Same thing.
Exactly.
Interesting.
Yeah.
Yeah, and that is amazing, because I've done that many times, and it's not fun. I will always go back to, I think it was the second trimester overview that we did, where you had said, do not call your doctor in a panic if you wake up on your back, because I've had patients call me in tears. It isn't worth it. You are fine.
You're fine.
And but it is that, everything you read pretty much says, not only sleep on your side, but sleep on your left side. Well, I'm typically a right side sleeper, so I will try and prop myself up on my left, but inevitably I will wake up.
And we can't control what we do in our sleep, and
no, I can't control the fact that I snore. But it is, and that I know has gotten worse. But that is, and it's, and I know it's far worse when I'm on my back than anything else, just because it is harder to breathe and to do those things. But sometimes you just, I think the weight just flops you back that way. I don't know. But I am very much looking forward to being able to lay on my stomach at some point.
But then you'll maybe be nursing.
That is true. That is an excellent point.
Later.
It's like every time I say, oh my gosh, it'll be so great to be able to have a glass of wine, and someone will say, the words pump and dump will go through your head and you won't even want it. I'm like, really? You just take all the joy right out of disagreement. We're gonna do a breastfeeding talk in a couple of weeks. I can't remember what date it is in the calendar. I'm very much looking forward to it because I'm really excited to hear all the things we have to say.
All the things.
Okay, so we've covered sleeping. I think in the summertime, the other thing I know that someone else brought this up, and I'm cold all the time to begin with, so I'm hoping that this just makes me a normal person. But the idea of getting too hot for the baby in the summer. And baby's temperature is
baby's
fine.
You can't get too. No, you're fine.
Okay.
Hydrate.
Yeah.
Yeah. Get in a pool. It feels so good in the hot St. Louis summer to get in a pool when you're
anytime
super pregnant.
Eliminate gravity.
Yeah. Oh, it's so nice.
Yeah. And then as far as, and we did a whole talk on, we call them birth preferences, correct? Preferences.
Yes.
Is there a point at which you should be talking to your doctor about medication options during labor?
Now's the time.
Okay.
So when I said we had less doctor-y check boxes in these visits that are getting more frequent, like now's the time. Anytime in your 30-ish, early to mid 30 weeks, write down stuff that's important to you, get something off the Google machine that has some, like an outline, and just see what is important to you, once you think about it a little more, not really committed to if it's a health safety issue that your doctor brings up to you, but have that talk now for sure.
And I think it's really important, and it was a group that I was in not long ago, a group of pregnant women, and someone had asked the question, it was what have you envisioned the birth experience to be like? And I blame you largely for this, that
I'll take it.
You will take it in a second, don't worry, we're not going anywhere. And I think a lot of people have very idealized expectations of what it's going to be like, and my response is get the baby out safely. And I think that I want to believe a healthy attitude to have going, and just because, as you said, I think it's important for women not to put so much pressure on themselves starting right now to make this an experience that something that you can't necessarily force it into being if things go differently.
I think having as part of your birth plan that the team really communicates with you in a way that you're comfortable with, that people respect your autonomy, include family members in those discussions if that's important to you, be really transparent and open and honest, all that stuff, like, I'm totally comfortable with. But writing down exactly what you want to happen on what timeline is just going to set you up to feel badly when inevitably at least the timeline or the events don't line up. And that's has nothing to do with the way you start your life as a parent with this baby. It's just how to get there.
Yep. All right. Well,
yes.
Terrific. We have another question?
Jocelyn.
Yes. We have two. It is not. It is Michelle.
Michelle. Hi, Michelle.
She says she's been eating yogurt with aspartame. How do you pronounce
aspartame.
that? Aspartame.
Yes.
Thank you. I don't know how to pronounce that.
Oh,
daily.
Gosh. If you say this
since the beginning,
issue.
and just recently looked at the label. Is it okay during pregnancy? She avoided it with the first, but she's too busy to read labels. It's fine.
Thank God.
Yay!
I was gonna say I don't. I probably have less of it only because things like that whole you shouldn't drink copious amounts of diet soda, not necessarily because you're pregnant, but because it causes other issues apparently down the road.
Like in a general over umbrella world, limiting your aspartame and going with sugar is probably better. Eating a few yogurts with aspartame when you're pregnant, oh my gosh, nothing. Don't even. Enjoy your yogurts. Yes.
Aaron, so 3 people asking questions.
Okay.
Hi, Aaron.
Aaron says, does the Pups Rash always spread across belly or can it stay on upper arms and chest?
Pups.
Belly.
What is the Pups Rash?
Well, I guess anywhere you have stretch marks. So the Pups Rash is a rash in late pregnancy that is really uncomfortable. It's like hives plus poison ivy rash in terms of like how
oh my gosh,
how it gets. It's so, oh my gosh, look at her face.
No, I've had poison ivy, and I don't tolerate poison ivy. Well.
It's not literally. I'm trying to describe how people have described to me that it feels.
Okay.
And it literally pops out of stretch marks. So I guess if you have stretch marks on your breasts or in your arms being pregnant, it could be there. I've only ever seen it on bellies.
Okay.
But
is there a point at which that? Well, let's start with. Is there a point at which stretch marks usually appear, or is it different? I know it's genetic.
For everybody.
It's
different for everybody.
Okay.
Yeah. But so does she have a rash that's on her arms that looks like pups? We can't go backwards.
She doesn't say. Let's see if she comments.
Okay. But you can do like prescription strength antihistamines, steroid creams, and histamine creams. You just kind of have to get through it and it will go away.
Yes.
Okay.
She says yes.
Yes. Interesting.
Mm-hmm.
Go to your OB, and if they are at all concerned it's not classic pups, they may send you to a dermatologist to get another opinion. Without seeing you, I can't give my opinion, but I've only ever seen it on bellies.
Perfect.
Yeah.
Interesting. All right. That brings up another point. I know that there was someone I know kind of peripherally who went to the doctor. I think she was 37 weeks along, and she was itching terribly. And she did not leave the hospital. She wound up having that baby right then and there. And that was a result of...
her hands itching?
That sounds right.
Palms?
Yes. What is that an indicator of?
Cholestasis of pregnancy.
Yes. It was a pop quiz.
Your bile salts that your liver makes that are stored in your gallbladder, they get really high, and it's really classic if people say they want to get like the wire brush in the kitchen and itch the soles of their feet and the palms of their hands. There's no rash associated with it. It's just intractable itching, and we usually induce people a little early because it can be associated with babies not doing well if they go like full term or post dates.
And so it's the what is it that's not functioning correctly?
It's like the bile salts in your liver and gallbladder. And there's a couple thoughts like, does your liver actually make more? Does your gallbladder not store it as well? Like, why does it get high in your bloodstream? I can't speak to that exactly, but yes, if you are itching like crazy, your doctor does a blood test, those levels are through the roof. There's medications to get you to like 36, 37 weeks along to not be so miserable, but typically we would induce at that point.
Gotcha. Are there any others, we start to wrap things up, are there any other signs or symptoms that if women experience you would say, just pick up the phone and call your doctor?
Yeah. Definitely headache that doesn't get better with Tylenol. That can be a sign of preeclampsia. Any vaginal bleeding ever in the third trimester, if you're worried your baby isn't moving as much, if you are wondering, is this just sort of third trimester, lots of vaginal discharge versus my water may be leaking. We already talked about the really bad leg swelling or the one-sided leg swelling.
What is preeclampsia?
Preeclampsia is when you get high blood pressure in pregnancy, and it also is associated with some liver changes, some changes in your eyes, some changes in your platelets. Like, it's a whole like constellation of things. But the point is, if you have high blood pressure in pregnancy that's not responding to medications, your placenta is just full of blood vessels. So you actually get high blood pressure in your placenta too, and the baby cannot get enough oxygen and nutrients. So there's a risk when it goes untreated that you actually may have a seizure, which is called eclampsia. So preeclampsia is all this stuff that leads up to the point that you might have a seizure, which in and of itself, if you're safe and in a hospital, is something that's fine. We can manage that safely. Baby's okay, typically, because doctors are there. But you need to be in the hospital. I'm going on like a side note here. If you have preeclampsia that turns severe, you need to be in a hospital.
Okay, gotcha.
Yeah.
For both mom and baby.
Yeah.
And we have another question?
Yes, Jacqueline wants to know. She says this is her first pregnancy. She's 37 weeks, 3 days, and in her last appointment she was 3 centimeters dilated and 50% effaced. So her question is there a magical number where upon a certain amount dilated or a certain amount effaced, they absolutely are admitted into the hospital?
We need her on our podcast. This is her podcast. She's asking like the best question. Is it the same Jacqueline?
This is different woman.
Everyone named Jacqueline needs to be a guest because these are great questions. The answer is actually no, roughly speaking. So what will get you admitted to the hospital for labor is if your cervix is changing and you're painfully contracting. So if you're 3 centimeters and you're living your life and you're occasionally uncomfortable, but you're not really, when you do have a contraction, you can talk through it, you can go for weeks. You can be 5 centimeters.
Say, how high can you get without knowing it? And I hope the number is 10.
I've definitely had people 5-6 centimeters.
Really?
Who usually not first baby though.
Okay.
But who are like taking care of their kids, going to work, yada yada, and I check them and I'm like, hey.
And when do you start checking for that?
37, 38 weeks. Every doctor's different.
Okay.
But yeah.
Late 30s.
Or anytime there's a reason to. Like if you're 24 weeks and you're contracting, I will of course check you. But just like routine stuff, last couple weeks of pregnancy.
Yep.
Yeah.
Another question.
Natalie says, can you talk about the suggestion to get a whooping cough vaccination? Who do you recommend should get it?
That is a great one too.
Yes, it is a really good one.
The Tdap. So you can't just get whooping cough on its own. That's pertussis. They're packaged with tetanus, diphtheria, and pertussis. So everyone in their 3rd trimester is recommended to get it. It confers a little bit of immunity to the baby. So when they're born, they've gotten some antibodies from you.
Do you get it even if you were updated before pregnancy?
Yes.
Okay.
So they get some antibodies from you, protecting them if they're exposed to it by the time their own vaccines catch up. So it's like protecting them in the first couple months of life. Anyone who's going to be around the baby a lot, so partners, grandparents, nannies should all be up to date. If not, just go ahead and get their vaccines done. Most people don't know. I, honest to God, don't know when I last had a Tdap. I know it's got to be every 10 years or they wouldn't let me work here.
I was going to say, we know here that they keep it in your file.
Yeah,
They check you every so often.
But
so I was going to say, I know
most people don't remember exactly. So I feel like go to Walgreens, go to your primary care doctor. Our office cannot vaccinate family members. I don't know how other offices are structured, but usually, a dad will say, can I get my Tdap here? And unfortunately we can't. But there's plenty of places that do vaccines.
And I think on that same note, another important one to bring up is, and it's less of a buzzy one right now, but flu shots.
Oh, yeah.
So, I mean, in the summer, you don't hear a lot about it, but say come fall, as soon as those flu shots are going out.
Everyone who's going to be around that baby needs a flu shot.
Okay, everyone?
Yeah, I would say so. I think this gets a little complicated, but I'm wearing my white coat, so I'm going to say everyone should get a flu shot. Typically people who work in healthcare, work with anybody who's sick, elderly folks, kids, schools, all these things. Yes, there's certain people who are at higher risk of getting flu. Pregnant women, 100%, because if you get the flu when you're pregnant, you can get so sick. But you're bringing a tiny baby with very little innate sort of immunity into the world. So people who are going to be around your baby, I would like and ideally to see them get their flu shot.
Yes.
That sentence was
we're very pro
nowhere
flu
close.
shot around here. There's just really no other way to cut it. So
yes. Okay.
The other thing I was going to ask you, and it's when you talk about if baby's not moving as much. Okay, so this is a 2-part question. One, as baby gets bigger, and I would assume is a little more confined in its space in there, does it move? Do you feel less movement?
It moves differently.
Okay, so you just I was going to say it's stronger, but tighter.
It's more rolling, stretching. It's not pow-pow.
Yeah.
Because there's just not a lot of room.
Yes. Okay, and so how do you know, or do you just know if baby's moving less than normal?
If you really are worried about it, you can sort of lay down, quiet, and sort of focus on baby. Maybe drink a little, maybe get yourself some glucola since you like it so much.
It's so delicious.
Drink something with sugar in it, something cold.
I will say it was the worst sugar crash I've ever experienced. It was brutal, but go on.
Well, a lot of times because the baby doesn't punch you the same, it just sort of rolls and stretches, you can be busy and think, oh my gosh, I don't know if I felt my baby move for a few hours. But if you really sit or lay down, have some ice water or glucola, you'll notice. Baby's fine. Yeah.
Okay.
But I am a firm believer, people talk about kick counts and you should feel your baby move all these times. I want moms who are worried their baby's not moving to call me. I just want you to come in.
And I mean,
I get a little spooked by it. I trust mom's instincts on so many things, and if you're like, you know what, I did this kick count thing and my baby moved enough, but it's just different, you call me. Well, I guess you can't call me if you're not my patient, but call your doctor.
Call your doctor. Well, and I think Jenny, who we are going to put in front of a camera at some point so you can see her face and know that she's a real person. You had that happen. You didn't, was it just that you noticed?
He stopped moving. It was like 4 p.m. I realized it. Called my midwife, and she had me come in.
California?
Washington State. Yeah. And so I went in at 9 a.m. and it was an umbilical cord accident. So he was delivered 6 hours later, emergency C-section, and they said had I waited one more day, he would have died because of the constraint of blood and oxygen to him. So that's why moms have to trust their instinct and call.
Please call.
Because wouldn't you rather people call
100%.
and just relieve their worry?
100%.
Yeah.
Well, and I know Dr. Carter, when we did many weeks ago now, an episode dedicated entirely to high risk, she had said, there is nothing that turns my stomach faster than hearing a mom say, I would have called earlier, but, and then it's been 3 days and she hasn't felt that baby move, because she said, I know what I'm going to find. And she said, so if you, in your gut, no pun intended, feel like something is up, it's worth a phone call.
Easy peasy.
Yeah. All right, terrific. If we don't have any other questions, all right, so we'll let you get about your day and your fabulous blue glasses. I love them so much. We will be back next week to talk about aches and pains in pregnancy. And
who's doing that one?
Katie Drennan.
Nice.
Yes. So one of our fabulous labor and delivery nurses is going to talk about relieving some of those common aches and pains, things you can do, and ways to, and this should amp up viewership, get a decent night's sleep. So we'll see if that's even feasible in the third trimester. I'm excited to learn myself. I was trying to pimp her for tricks when we were talking to her a little bit ago. So thanks so much for joining us. We'll be back next week.
Have a good weekend.
Have a great weekend.